Welcome to our clinic. If you're watching this, chances are you're dealing with chronic knee pain and you're searching for more than just temporary relief. You want answers, you want solutions, and most of all, you want your life back. You are in the right place. Knee pain is one of the most common and disabling conditions in the US. Millions of people suffer daily, and yet most are trapped in the same cycle: medications, injections, rehab, and for many, eventually, surgery. But here's something most people don't realize. Over 93 million Americans deal with knee pain. More than 107,000 people are hospitalized every year due to complications from common pain medications, like over-the-counter anti-inflammatories. They may dull the pain, but they don't correct the cause. Knee pain is your body's check engine light. It's trying to tell you something is wrong, something deeper than inflammation alone. Let's say you're driving and your check engine light comes on. What do? Would you throw duct tape over the light? Would you have the mechanic reset the engine without fixing the internal problem? Of course not. You'd likely take it to a mechanic. They'd diagnose the issue, fix the engine, and send you safely on your way. But what if you just covered the light with a piece of tape and kept driving? Eventually, the engine would break down. That's what happens when we rely solely on painkillers or injections. They reset the warning light, but the internal damage continues to worsen, until the joint is bone on bone and we have to manage the damage, or worst case, surgery. Here's the problem. The conventional system is designed for acute care, emergencies, injuries, trauma. But knee osteoarthritis and other knee conditions are chronic degenerative condition. It needs a long-term structured strategy, not a temporary fix. Most people don't get worse because they ignore their pain. They get worse because they're trapped in a system that wasn't built to fix chronic joint degeneration. That is why we do things differently. Think of your body like a high-performance vehicle. To operate at its best, it needs a solid frame, your structural integrity, a well-tuned engine, your nervous system and communication pathways, clean fuel and proper weight, your metabolic health. When we assess your knee, we evaluate all three. Because if one system is off, the others can't compensate for long, and the result is pain and dysfunction. You may have been told knee pain is just a part of aging, but that's not the whole story. Knees don't just wear out because you're getting older. They break down when posture is imbalanced, the nerves controlling the muscles around your knees are underperforming, extra body weight adds unnecessary stress, and inflammation goes unchecked due to metabolic dysfunction. Yet most evaluations only look at X-rays or MRI images. They see the damage, but don't look upstream to what's causing it. We do. Our process addresses the entire chain of breakdown, starting with alignment, nerve control, and inflammation. If you're a candidate for our program, we'll create a personalized plan built around structural correction to improve alignment and joint loading, neurological retraining to reactivate weak stabilizers, metabolic support to reduce inflammation, improve blood flow, and restore healing. Together, these create an internal environment where your knee can begin to recover, not just compensate. Did you know that many people with knee pain also have lower back nerve compression, even without back pain? That's right. The nerves that control your quads and hamstrings originate in your lower spine. If those nerves are compressed, the muscles around your knee don't get proper signals, and the knee collapses faster. We test for these neurological imbalances. Because if your nerves can't fire, your knee can't stabilize. Let's talk about metabolic health. Every pound of excess weight puts 4 extra pounds of pressure on your knee. Inflammation from poor metabolic health, gut issues, or hormone imbalances also slows your joint recovery. Have you ever had a day where your knee pain felt worse for no reason? That's inflammation at work, driven by hidden metabolic imbalances that no injection can fix. This is why we evaluate beyond the joint, because knee pain is often a whole body problem. If you're accepted into our program, we'll map out your structural, neurological, and metabolic health to uncover exactly what's contributing to your pain. The best part? We've helped countless people, just like you, people who were told surgery was their only option, stabilize and recover without it. You may not need surgery, you may not need lifelong medications. You just need a better approach. Your body is capable of healing when you stop silencing symptoms and start addressing the causes. And that starts today. A team member will be in shortly to learn more about your goals, explain the next steps, and see if you're a good fit for our program. We are honored you're here. Let's take the first step together.